The next speaker is Dr. Narendra Singh Verma. So he'll be speaking on comparative analysis of SIA calculators based on vector method and polar method in cataract surgery. Over to you.
Good morning, everyone. So I present this. So this is the study which was done a few years before. They measure the mean SIA and centroid SIA of 2.8 millimeter temporal incision, phaco incision. In this study, they find out that the mean SIA is 0.5 and centroid SIA is 0.18, which is 3 times lesser than the mean SIA. So centroid SIA is lesser in magnitude. It was well documented by Dr. Saurabh Savne, who developed the SIA calculator, and it is also...
Now, the next issue that I would like to talk about is surgically induced astigmatism. Well, this is a highly controversial issue, and unfortunately, I'm not going to give you here the right answers. Rather, I want to share with you some of my thoughts and dilemmas. So many of us tend just to use 0.5 diopters for our SIA, just arbitrarily. And the question is it acceptable? Maybe we should use a quarter of diopter instead, or maybe even 0.
So this is Dr. Abul Afia. He is saying, what should I take the value of the centroid SI in my toric calculator? Should I take it 0 or should I take it 0.5? So this is the problem. So let's see how we can solve the problem. So the SI calculator which we are having presently, they measure the SIA, mean SIA and centroid SIA. And these value, the mean SIA value is used. We know the SIA, mean SIA of our incision. Then we can take the ST passage incision and reduce the astigmatism. Centroid SI value is used in the toric calculator. So, but it is lesser in magnitude and misleading. So we can see this is how we are measuring the centroid SI by double angle plot. This is Dr. Warren Hill SI calculator, double angle plot. In this case, centroid SI value is 0.06, which is 3 times less than the mean SI value. If I will select these, if I operate these two cases, which I have marked with the arrow, in this the individual SI is 0.8. And I am taking value of centroid SI 0.06, which is 14 times lesser. So what is the use? So there is no use to put the centroid SI, take the incision SI value. Better to take 0. So this is the same problem with the this practical problem. If consider that there is 2 diopter of astigmatism in 110 degree, and my incision 2.8 millimeter temporal incision is creating 0.3 diopter of SIA. If I will take incision on the steep axis, the recommended IOL power is T3. If I will take incision temporally, the recommended power is T4. So by shifting the incision to the steep axis, I can reduce the power of the toric lens. But it is not recommended by Dr. Graham Barrett. He is saying that when you are implanting the toric lens, don't use the incision SIA to reduce the astigmatism. So don't go on the steep axis, do the OCCI or something else, some part of SIA reduced by the incision and some part by the toric lens. So let the toric lens correct the astigmatism. So the present problem is this, that now when we take incision on the cornea, there is 2 types of changes. There is change in the cylindrical power and there is rotation of the steep axis. So the present SIA calculator, they measure on the cylindrical power change. They don't measure the rotation of the steep axis. So these are the vector method, problem of the vector method. I will tell you about the polar method. In vector method, we use this simple formula. This is the polar method. In polar method, the SIA is measured in 2 components. One is which tell about how much is the SIA causing the change in the cylindrical power and how much SIA is rotating the steep axis. The vector summation of these both is same. So we developed this SIA calculator, which is free online available. Just you have to scan the QR code and we'll get access. These are the we have validated it with Dr. Warren Hill SI calculator, which is based on vector method, and Dr. Neil Alpine SI calculator, which is based on polar method. Now these are the interesting cases. I have operated 57 cases, 2.8 millimeter steep axis incision and 2.8 millimeter OCCI. My aim was to decrease 1 diopter of astigmatism when patient was not affording for toric lens. And these are the 12 cases of Dr. Deepak Meghur, who has taken incision on the temporal incision, 2.8 millimeter temporal incision. It is not on the steep axis. First one is on the steep axis. So these are results. Now these are the results. Mean SI in first group, 2.8 millimeter main incision, 2.8 millimeter OCCI is 0.77, and in 2.8 millimeter temporal incision is 0.55. So it's okay. 0.5 for 2.8 millimeters is okay, and 7 it's okay. But see this, in the group 1, the mean SIA is 0.77, out of which 72% is causing change in the cylindrical power. 28% is rotating the steep axis. While in the group 2, mainly the change in cylindrical power is only 46%, and the rotation of a steep axis is 54%. So when our incision is not on the steep axis, then the rotation of the steep axis is more as compared to the change in the cylindrical power. So this is the same thing. So what we get from the group 1, the centroid SIA, which is mean SIA is 0.77, centroid SIA 0.50. It is lesser, but it is acceptable. In group 2, which was not on the steep axis, the centroid SIA value is 0.12, which is 3-4 times less than the mean SIA. So we can predict centroid SIA value by polar method more accurately when the incision is on the steep axis. When incision is not on the steep axis, then we can't say anything. So
Thank you, Dr. Verma, for the presentation.